Well, hi everybody. I am Dr. Jessica Dalton. I am the University Partnership Manager for VetRec, and I'm also a veterinarian. I have about 7 years of clinical experience in general practice and hospice medicine, and I'm really excited that you guys decided to join me and also join me and my coworker Sue. I'm going to let her introduce herself as well.
Hello, everyone. I am Sue Browning. I'm an implementation specialist here on the VetRec team. Really excited to be joining Dr. Dalton today, and we'll be here in the chat throughout the webinar to help answer any questions.
Yes, absolutely. Please chat in and ask us questions. We are here to kind of just show you how we are getting started. As a practice veterinarian, I found it really overwhelming to get into AI, honestly. I was like, man, it's just one more thing that I have to add into my day, but I'm so glad that I did it because it ended up saving me so much time. I was spending, sometimes 3 hours after seeing all my patients just writing up records. So the point of this is really just to show you how easy it is to get going. And then hopefully we'll be doing more of these to show you all of the features so that you can really work it into your workflow to just maximize efficiency. But the first step is just getting started. So I'm going to go ahead and share my screen with you guys so that you can see it. Let me grab it. Okay. So you all should be able to see my screen now. This is going to be the landing page for both the website and also for our mobile app. Our mobile app works on iPhones and Androids. I found in practice that I used kind of a combination of the two, honestly. I would use the computers, but we didn't always have computers in every single exam room, so I was having it recording on my phone, just in my pocket. And then I would walk around the treatment room with it in my pocket recording as well while we were doing treatments and discussing hospitalized patients with technicians. So this is our landing page, and it really is as easy as just hitting this big blue button here. I don't even have to put in the patient's name if I don't want to, or if I'm short on time, or if it's an emergency and that's just not happening. As long as I say the patient's name, it's going to start recording. Um, so I'm just going to get going here. We're going to hit start recording. It's going to be asking for consent. And every hospital really deals with this individually. So whatever works best for you, it might just be saying a verbal consent, or it might be saying, hey, we're going to have you sign some paperwork beforehand. And then I usually just keep it very brief and say, hey, I have an AI scribe going in the background, and I just want to make sure that you're okay with that. It's only so that I can fill out my notes and send you home discharge paperwork. So just keeping it really simple. And I'm going to have Sue here help me make a medical note. So I'm going to say, hi, Sue. I have my AI scribe going in the background. Is that okay with you that you are being recorded right now?
Sounds great.
Perfect. I'm going to hit consent. And as you can see, it recorded that entire little conversation that I was having. And I'm going to say, all right, well, it's great to see you and Cooper again. How's this handsome boy been doing since his last visit?
He's been doing really well, thanks. We're just here for his annual exam today. No real concerns on my end. He's just his usual happy self.
That's excellent to hear. Hi, Cooper boy. Before I examine you, I just want to go over two quick questions with your mom. Any coughing, sneezing, vomiting, or diarrhea at home recently?
No, nothing like that. He did throw up one time. It was about 2 months ago after eating some grass on a walk, but that seemed to be a one-off. Overall, his stools have been totally normal and no sneezing or coughing.
Perfect. And how about his diet?
Yeah, so he's on Hill's Science Diet adult dry food. He gets about 3 cups a day, which we split between morning and evening. He also gets a couple small training treats during the day and one dental chew before he goes to bed.
That sounds like a great routine he has. Is he on any current medications or supplements that we should know about?
Yeah, just his Empirico Trio once a month as a preventative. No other medications or supplements.
That's great. Let me just confirm the history that I have here in his chart. It looks like he was neutered at about 6 months old, and last summer we saw him for a mild ear infection on his right side that looks like it's cleared up after a short course of medication, but otherwise nothing significant I have noted. Does that match what you remember?
Yeah, that seems to be everything.
Perfect. So it looks like he's due for his vaccines today. Um, he's been up to date on his distemper parvo, his rabies, his bordetella, and his lepto. All of those were boosted at his last annual exam. His distemper parvo, lepto, and bordetella are due today, but his rabies is still good for one more year.
Great. Let's go ahead and get those done today.
Perfect. All right, Cooper, come here, buddy. Let's get you weighed and all checked out. Okay, I'm going to just talk through his physical exam, not only so that, I can let you know what's going on, Sue, but also so that the scribe can hear the physical exam findings, and record those for us.
Sounds good.
Okay, so his weight is 68 pounds. That's just up 1 pound from his last visit. His temperature is 101.3, his heart rate's 96, and his respiratory rate is 24. Those are all nice and normal values. His attitude is bright, alert, and responsive, and that tail just won't stop wagging.
He's such a ham.
He is. So his body condition score is the 5 out of 9, which is right where I want him to be. He has no pain on palpation anywhere, and his pain score is 0 out of 4. His capillary refill time is a nice 1 to 2 seconds, and his mucous membranes are pink and moist. That's exactly what we're wanting to see. He's very relaxed here, which is amazing. So I'm going to give him a fear, anxiety, stress score of 1 out of 5. He's panting a little bit in between, but he's basically enjoying the intention. Looking at his eyes, his corneas are clear, no discharge, pupils are nice and normal. Ears look great too, mild debris, but no redness or erythema. Um, Looking like a big improvement from last year's physical exam findings. Looking at his mouth, he has some minimal tartar and just a little bit of gingivitis starting along those upper premolars. I'm going to call it a grade 1 out of 4 for his whole mouth dental score. Overall in good shape, but we'll talk more about home dental care here in a minute. All of his peripheral lymph nodes are normal, no murmurs, arrhythmias, and his femoral pulses are strong. His lungs are clear bilaterally, no crackles or wheezes, and his skin coat looks great. His abdomen is soft and non-painful, and he's nice and ambulatory with no obvious lameness. I'm not going to do a full neuro exam today, but his CPs were normal, and I checked his cranial nerves were all intact. We won't do a rectal today, since there's no clinical indication and he's not yet 5. I typically start those when we get a little bit earlier or if we're seeing any urinary issues.
Great. So overall, everything looks good.
Everything looks great. Apparently, a healthy patient on exam today. So his plan is we'll go ahead and give him those boosters. And I'd also like to run his routine heartworm test and fecal since those are standard for his annual.
Yeah, let's go ahead and do it.
Perfect. No treatments. He's already on his Simparica Trio, so we'll go ahead and continue that for another 12 months.
Perfect.
I'd recommend that we continue his current diet and exercise. I do want to talk about his dental care here for a minute. Let's go ahead and start brushing his teeth if we're able. He seems like a sweet guy, so I think he'll take to it well. We want to use a pet safe toothpaste that tastes really good. And then let's think about getting him in for a dental cleaning next year.
Sure, we can definitely look into that.
Great. Uh, let's plan on seeing him back in 6 months for his biannual exam. Sooner, of course, if anything comes up, and we'll go ahead and give you a call in 48 hours with that heartworm and fecal. Uh, if there's anything off, of course, we'll go from there.
Sounds perfect. Thanks, Dr. Dalton.
Perfect. I'm going to go ahead and stop that recording and show you guys what we made. It's going to take a second to upload. It is pretty quick though. But if you're like me, sometimes I walk away and come back. All right. So we're going to go ahead and hit this generate notes. And it's going to transcribe that for us. Looking over on the side panel, so just to say, if you had more time or if you were like me and sometimes you would have your CSRs or your technicians going ahead and creating visits for you to start the day. we have integrations with a number of platforms or PIMs. So sometimes you'll be able to just sync visits right on over. Other ones, we can just create visits, or if you have a surprise visit, you can always create a patient. So if you wanted to, you would always want to include a name. I would probably put a last name because we all know there's about a million Bellas that we're going to see. So I would say Bella, and then we'd say last name Cruz, and we'll go ahead and create that visit as well. Okay, so Bella Cruz doesn't have anything, but we can go and see all of our visits. Oh, we're on the wrong day. And there's Cooper. So as you can see, we have a full note that generated as basically as soon as we walked out of the room. Now, if we say wanted to send our technician back in because maybe they wanted to go over the dental a little bit more, maybe we wanted to send home an estimate so that they could start planning for that, talking about how next visit in 6 months we might talk about doing some blood work prior to that. We can always add to this, okay? So just because we have a note made doesn't mean that we can't do anything with it. We are fully able to make modifications and continue adding to it until we're done with our visit. All we would have to go do is add visit. If I wanted to create a whole new note, so maybe I just wanted a note about dental care, I could create a new note and talk to the note owner about that, or I can add to this existing medical note, and I would just hit start recording. When I was done, I would hit the generate note just like I did at first, and it's going to populate information over here into the medical record, and it will be all ready to go. Um, this is all template based, okay? So you can make your templates exactly what you want. This is one of the things that I love most about VetRec is because I want my medical notes to look how I want them to look. And I want them to look that way every single time. And so by having a template that's customized to my needs, I get consistent medical records. And I don't have to spend all that time writing them because it's much faster just to read them and proof them. You still do need to read and proof them though, okay? I can't stress that enough. It generates it, but you're still wanting to look this over before you transfer it into your medical record and sign off on it. But it's a full medical note. As you can see, it has everything filled out. You can choose templates that have pre-populated findings in it. So say you wanted every eye exam, unless you said otherwise, to say no significant findings, corneas appear clear and free of discharge, pupils are normal, and globes are symmetrical OU. Because you know that you looked at it, even if you didn't verbalize it. You can put that in as a template, and it's going to populate every single time. Say something was wrong. So that maybe I said we're going to send home some amoxicillin and it said clavamox instead. You can highlight that area and give us feedback. We love getting feedback from you guys. We love positive feedback, but we also know that negative feedback is just as important so that we can make those corrections. Because if we're seeing, it's getting the clavamox and amoxicillin confused more often, that may be a fix that we need to make on our side. So please give us feedback when it says something that's not what you want. If you have more immediate concerns, so something's really not right. So maybe this didn't generate at all. You can also jump down here into the chat box. I'll show you this. So you just hit the chat box, go to messages, and chat with us. And up here you can see the wonderful people. These are real people. These are real veterinary professionals that have worked in the field that are waiting for you and want to help you. They are available 8 a.m. to 8 p.m. Eastern Standard Time, but we are growing our team to cover all of the different time zones as well. And they are great. And we try to get back to you in under 15 minutes. That is always our goal. and they work very hard to resolve your issues and to escalate issues to our engineering team if that's necessary. So I always want to point that out that we're real people on the other end, never a chat box because even though we're an AI company, support shouldn't be AI. So we have our help, okay? We have our note. Just like any type of Word document, that's how I kind of think about it. You can make changes within here. So you can bold, you can italicize. If there's things that you want bolded every time, I would recommend we put it in your template to bold it every time. That way you're not going through and saying, well, I want Simparica Trio to always be bolded. We can make that kind of a part of your template to say we want preventative medications to always be bolded. If I did not want to type in, I could also just hit this start dictation button and start dictating. So wherever my cursor is at is where the dictation would be. So I can either type or dictate. I'm not stuck um, making changes through typing, basically. Something that I love to point out to people who are getting started, because this is something that I found very helpful, is the snippets button. And snippets are basically those conversations that you have very, very often. So you have your spiel that you give to the dermatology dogs, right? You have your preventative spiels of the importance of prevention. You have your vaccine reaction spiels that you're going over every time. And when you say it, you can also put it into the template, but say you want more information on a medication too. You do a lot of carprofen, you have a lot of older dogs. You can insert a snippet, so I'm going to put it under medications and we will hit insert a snippet and we will choose our snippet and I have carprofen. And as soon as I hit that, it's going to pre-populate with Cooper is going home with carprofen and information about carprofen. So I'm not having to go over that every single time, or maybe the technician's going over it and she's not recording it, but it's still making it into the medical note every single time. For getting this into the medical record, we can come over to this side. So we have options, of course. We have integration options with a number of different PIMs and software. So it really depends on those. If you have specific questions about those, please reach out to us and we can get those answers to you. You can reach out in the chat box or through your representative that you have. Either will work because sometimes we have direct integrations or Chrome extensions that we can point you to. But there's always the good old copy and paste. And we can do that the old-fashioned way, which is the way I usually do it because I just highlight and I drop it right in. Or you can come over here and actually copy the entire note, and then it's going to copy to your clipboard and you can drop it into your medical record that way, or you can download it as a PDF and put it into your medical record that way. So lots of different options there. Every time you make changes, it's going to ask you to save those changes, so we'll go ahead and save. You can lock visits, okay? So after you've completed your note, you don't want CSRs or technicians making any additional changes. You can lock it just like you would lock it in the medical record after completing the visit. So that's a possibility as well. Going up to the top, I do want to just show you discharges. Discharges are also template-based, and just like a little fun thing, we have some fun changes coming to discharges that I'm excited for, so definitely stay tuned there. But we have templates. We can help you make your own discharge template, and you can actually email these right from the platform. So basically, I would read this over, make sure it had everything on it that I want for Cooper, and then before the owner even left, I am sending an email. And it's going to attach. I can also attach the soap notes if I wanted to, or medical findings, anything that I wanted to attach, I can attach there. And then I would go ahead and send it to the owner. And before they've even walked out the door, charts done, and I have already sent them their discharge paperwork. If I was wondering what I had said, or maybe a question came up, I can actually look at my own transcript. And you can see it's marked as doctor and client, so it's picking up the two different voices and conversation. And I can go back and say, did I ask about coughing and sneezing? Or maybe for the technicians, did I ask about coughing and sneezing? Yep, sure did. Nothing like that. Um, he did throw up one time. It was about 2 months ago after eating. Not a big deal though. Um, so this is a really handy thing that you can use to double check yourself, double check your notes, because if you're not doing it, right away and you're still waiting to the end of the day, it's still going to save you time. And now you don't have to remember what the conversation was. You can actually just go back and either listen to it or read it, which I found very, very helpful. So this is basically the notes and the discharge in a nutshell. There is so many different functions and things like that that I also want to share with you. Um, do we have any questions up until this point, Sue?
We currently do not have any questions in chat.
No questions in chat. I'm just doing a great job of explaining it.
Absolutely. Yes. Oh, wait, we do have one question. Let's wait while they
Yay.
type it.
Perfect. Um, yes, there is one function I wanted to point out while we're waiting for any questions to come through. Please don't be shy. If you have a question, other people have a question. That's what they tell you in vet school, and it remains true throughout life. We do have David. David is the actual AI agent, and he can help you in many different ways. Okay, he is not going to pull information off of Reddit. He's not Chat GPT. He is pulling information from verified, published veterinary sources. You still want to verify information, of course, but if you have tricky cases and maybe you just want to generate differential so you can compare against your own thoughts, that's how I use David. Is I have of course my own thoughts and my own ideas about the case, but sometimes you're in a you know situation where you're working by yourself and there's no one around to bounce things off of, and maybe you're saying, hey, maybe I'm missing a differential. You can always ask, and that's going to give you some great ideas to just kind of get your brain working. Um, he can also pull up blood work and things like that and make tables for those kidney cats. I find that also very helpful. Did
All
they
right.
finish writing their question, Sue?
Yes. So the question is, what is the difference between changing the status to completed versus locking?
Oh, that's a good question. So when you lock it, you're not going to be able to make additional changes to it unless you unlock it. And anybody else, so your team that has access to the VetRec would not be able to make additional changes. If you're just completing a record, if you went back into it, you would be able to still continue to make changes in that record. Um, and you could even still add new notes to it. So locking it is definitely a more complete way of saying, hey, this note's done. We're not touching it anymore. That's a great question.
Yeah. One other question. Oh, maybe two other questions. How did you find David on the screen?
Yes, absolutely. So David so you have all these blue buttons up here. You have your trash button. You have a lock up here as well. You have your email. You have your VetRec assistant, which we can talk about. You have David. So David looks kind of like a question, like a chat, kind of like a chat box or a thought bubble. You have phone, and then you have your ad visit. So all I did was click on David, and he pops up. And then I just make him go away right there. If we click on our VetRec assistant, this is actually something that we are working on right now. It's in beta, but we are working on billables. And it's as you basically go through things, it's going to put them into treatment, vaccines, diagnostics. Um, that's going to be a larger rollout, and I'm very happy to do a full webinar on that once we have that out to the masses. But excited for that as well. Great questions.
Dr. Dalton, we have another question.
Okay.
I have a template for wellness and one for rechecks.
Mhm.
How can someone choose one of them once appointments for that day have been entered? So a visit has been created. How do they then select templates for that visit?
Yeah, how would you change your template? So you have options. So you can select your template as soon as you make a note. So when you go to, we're just gonna make, say, create a new note because that'll pop up. Your templates are gonna show up right here in this spot above where you would add. So this is what it's gonna look like, and you could choose your template. I would recommend favoriting your favorite templates so that they're gonna show up right away. But you can also have favorites, teams, and personals, depending on how big your hospital is, if you have multi-departments. So you would choose your template right here, and that's going to be the one that it generates. Say I chose the wrong template, so I actually didn't want to do GV soap. No big deal. Just go over to actions, regenerate note. It's going to ask me which recording I want to regenerate. I only have one for this visit. And then you would still be able to choose, maybe I want to do general patient visit. And then I can hit regenerate note, and it's going to regenerate my note for me using that new template. So even if you get it wrong or you pick the wrong one by accident, you're not stuck with it. It will regenerate it. So this is going to go ahead and fill it out for this particular template. For discharges, a really cool thing that I found useful is that you can change the language as well. So if you have a uh, family that comes in and their first language is not English and you want to send home it in their language, we probably have it because we are adding to the languages. I feel like weekly, right? So we are always adding languages, but you would go to actions again, change language, and you would be able to pick from many, many different languages. But I'm going to say Spanish and change. And then it's going to rewrite my discharge notes into Spanish. And we all know that that can really increase compliance, and that we want to provide the owner with as much information about what happened and what our next plan of action is. Great
Dr.
question.
Dalton, we have two other questions.
Okay.
First one is, where do I generate a template?
Yes. So for making your own template, you'll go over to the side. So your VetRec will probably look like this. I always open it up because I need words. So I open it up and it's going to say templates, and you'll go to templates right here. Okay. How you make your own. Okay. So there's options. How you make your own is you'll go to create template. You can upload a sample template of what you already use. So basically, you have a case, and it's a really good case. It's one that you filled out all of the spots. It's your ideal case. You upload that, hit generate template, and the AI is basically going to do the work for you, and it's going to build it out. You can also start from one of our template libraries. So it will basically make the skeleton for you and then help you to fill it in. We have AI prompts that help you to fill that in. Or you can start from scratch. 99% of people do not need to do that. That's probably hard mode. I would start with either uploading a template that you already use or a case that you like, or start with the backbone. Or if you're like me and you're like, there's no way that I'm gonna make a template. Like I have no interest in that and I don't want to do it. You can request a template, okay? And that comes to us and we build it for you, okay? We work with you to build that out. Um, when you hit that, it's going to take you to this basically, and you're going to fill this out. It's going to ask you to drop in sample cases so that we know what your notes look like and what you're aiming for. And then we'll usually ask you to test it out, test run them after we've done it, and then we make tweaks as needed, okay? You're never stuck with a template. We can make as many changes to it as you'd like. So those are both options for creating and requesting a template. And I can definitely go into depth with about making a template on a future webinar because I think walking you through how to actually make one is a great resource. But if you don't want to, you can always just request.
We do have two other questions. I know we're at time here, but we'll
We
take
are.
these. How do you record a medical record on a cell phone in an exam room and then transfer to a regular medical record on a computer?
Yeah. So no transfer of the one from the cell phone to the web-based one is needed. It's going to automatically do it as long as you have stable Wi-Fi. And if you don't have stable Wi-Fi, but you still have like cell service, as soon as you get on stable Wi-Fi, it'll upload it. So once you've uploaded it, or basically probably 2 seconds after you've closed it, it will show on the website one. You'll be able to move it right from the website to your PIMS? So that's a great question.
Next one, can we generate notes for multiple pets from a phone call?
From a phone call, yes. So what we would do is we would make the template for your phone call to pick up basically and separate out different pets. That's how I would organize that is I would have a template that said, hey, when it starts talking about this pet, I want, a section. When it talks about this pet, I want a section. If you're just making a medical note, all you have to do is hit the multi-pet button. And that will give you patients one, two, you can add up to 10 patients. And in small animal, that would be a lot. But I routinely saw three. So you can do multi-pet that way. For phone calling, you would want to have a template that was going to parse out the different patients. Is that all our questions?
That is all of our questions. Thank you so much, Dr. Dalton.
Thank you so much. Thank you for coming, and I hope you enjoyed. If you have questions, please reach out to us, okay? We want to help you. That's all we do. That's why we're here. And we want to make this an easy experience for you and get you going because I really do think it's a tool that's going to change your practice and change your life. All right. Thank you, everybody.
Thank you, everyone. Have a good one.
Have a good one.